Mayor Leary and Gaylord Baird, and welcome to this community briefing. Joining us once again to provide interpretation is Margie Propp, and thank you, Margie, for providing your services. And thanks to all of you for tuning in to learn more about the latest local developments and how you can keep yourself and others safe. Unprecedented energy demand due to record cold temperatures led the Southwest Power Pool to declare an energy emergency alert yesterday, one that required Lincoln Electric System to implement rolling electricity outages. For the latest updates from LES on this fluid situation, please check their website at les.com or follow them on Twitter at LESupdates. If more planned outages occur, they should not last longer than an hour. And if you experience one that does last longer than an hour, please report it to les.com/report, or you can call 1-888-365-2412. Please do not call 911 for a power outage. Our team at Lincoln Transportation and Utilities wants you to know that if you encounter a stoplight that is out, please consider the intersection a four-way stop. And as we work through this situation, it's important that each of us does what we can to conserve energy. We take all of these steps in an effort to protect the reliability of the electric grid and to prevent large-scale blackouts. Thank you for doing your part, and please consider checking in with your neighbors who may need support through this time. And speaking of time, in the long arc of this pandemic, it was about a year ago when many of us first heard the phrase novel coronavirus. We had far more questions than answers. Many people packed up their monitors and headed home to work. Students on spring break did not return to their classrooms. We added social distancing to our lexicon. Volunteers and businesses pivoted to produce hand sanitizer and PPE, and eventually we masked up to slow the spread. Our individual and collective sacrifices protected us and prevented many, but not all, losses. COVID-19 has taken the lives of 212 of our neighbors, a heavy toll on the families who call Lincoln and Lancaster County home. Knowing how much has been and continues to be at stake fuels our local response efforts, which for most of 2020 primarily consisted of playing defense. Our posture changed, however, when scientists made their miraculous breakthrough and we began in December to administer safe and effective vaccines against COVID-19. We began to play offense. And I'm here before you today to share that our health team's offensive game is strong, and as a community, we are making excellent progress. And before I share some highlights of our progress, I want to make clear that our health team is working according to a plan that is both structured and supply-driven. The prioritized phasing of vaccinations we are implementing comes to us from the state and can be viewed on our website at covid19.lincoln.ne.gov. And the pace at which we advance through the plan's phases directly correlates to the supply of vaccines allocated to us by the state. The governor and his team allocate doses to Nebraska's health districts based on population. As per state directives for our current phase, Phase 1B, 90% of the doses we receive must go to community members ages 65 and older, while the remaining 10% of doses are to be utilized for prioritized groups of workers. So to sum up, there is a phased plan for administering vaccines. We are implementing that plan, and we are moving through the phases as quickly as our allocation of doses allows. So let's talk about where we are now in the process, the remarkable progress we have made in the past couple of months, as well as what comes next. Frontline healthcare workers, EMTs, and long-term care staff and residents who comprised the first vaccination phase, Phase 1A, have received first doses, and thousands of them will receive their second doses this week. We began vaccinating people in the second phase, Phase 1B, this month, and already approximately 10,000 seniors, most of them ages 75 and up, have received their first doses. And this includes the nearly 5,000 individuals who got vaccinated during the clinics just this past Friday and Saturday at the Pinnacle Bank Arena. This week, the health team and our partners will begin to vaccinate seniors ages 73 years and up. Together with our pharmacy partners, we largely completed first dose vaccinations for individuals in local independent living facilities. We are vaccinating community members identified by our physician partners as having some of the highest risk medical conditions. We also have made good progress on vaccinating groups of workers prioritized within this phase. First responders are largely completed with first doses, some with second doses. Vaccination of utility workers is underway, and barring unforeseen circumstances, we plan to complete their first doses this week. Following utility workers, homeless shelter staff and correction staff are next in line. Which brings us to educators. Throughout the pandemic, our health team has worked closely with schools, colleges, and universities, and that work continues as we prepare to vaccinate these dedicated professionals. Based on current vaccine supply, and assuming no unforeseen barriers or changes in circumstance arise, we anticipate beginning vaccination for educators 3 weeks from now, by the start of LPS spring break. Vaccinating educators, a group we estimate includes more than 20,000 individuals, will take time. It will take time because of our limited current allocation of about 5,000 doses per week, and because of that 90% 10% directive we must follow per state guidelines. But even so, we are thrilled that we can now see the starting line for educators in this race against the virus. And in preparation and support of vaccinating educators, a unique link for educators to get registered will be sent via their employers starting today. So I just want to say thank you once again to all of our hospital, physician, and community partners for helping to make this progress possible. And thank you to the hundreds of volunteers who staff our clinics. And thank you to all of you for your patience and perseverance in these extraordinary times. And here with more details about our vaccination efforts and local conditions is the leader of our extraordinary health department team, Health Director Pat Lopez.
Thank you, Mayor. I'm excited to report that last week was a record one for getting shots into the arms of Lancaster County residents. Last week, our health department and its partners administered more than 8,200 first doses of COVID-19 vaccine, our highest weekly total so far. As the mayor mentioned, about 5,000 of those people were vaccinated at our clinic for those aged 75 and up, Friday and Saturday at the Pinnacle Bank Arena. A big thank you to the thousands of residents who dressed warmly and braved the winter weather to get vaccinated. One of those was local musician Ed Love, and he joins us now by Zoom to tell us about his experience. Welcome, Ed.
Thank you very much. I got to admit, I was kind of worried at first when I first heard about the Pinnacle Bank Arena site, because it's a big place and parking and all that. But when we drove down on Saturday, found on Arena Drive, there's a big sign pointing, go this way, and some volunteers out in cold weather pointing this way and smiling and waving, and got us into the parking lot that's right connected to the Pinnacle Bank Arena. Didn't even have to walk across the street. We were pointed into an entrance once we got our car parked. Had to walk 40 or 50 feet from the car to the door. There was an assistant there ushering us onto the elevator. We had to wait until the previous occupants had left, and only 4 people were allowed on the elevator. Got upstairs to the 3rd level, were met by more volunteers that pointed us this way, checked us in, gave us a form to fill out, a little questionnaire. Are you allergic to this, and this? It took about a minute, and before we had finished filling them out, there was somebody there to take them from us and pointed us this way. Got our shot, had to wait for 15 minutes, and we were on our way home in about a half hour. It was truly painless in every sense of the word.
Thanks, Ed. I'm glad you had a positive experience.
The only type of positive experience you want in this situation, yes.
Yeah. So, as Ed was talking, you heard about, he mentioned several of our team members. And the success of our COVID-19 vaccine clinics is really the result of that great teamwork among arena staff, our community partners, our city staff, and many volunteers, many volunteers. We were happy to see our Children's Zoo Director, John Chapel, volunteering on Friday, and he's joining us now by Zoom. Thank you, John, for stepping up to help us.
Pat, it was a great honor to be there Friday in assisting in this momentous situation. And, I said, I'm going to take the day off and we're going to do something great for our community. And I was so impressed with the organization, like you said, the staff of the arena, the professional medical folks, the health department, all those volunteers. Yeah, I never saw so much energy put together to make such a wonderful thing happen. And the exceptional turnout. I mean, people of all kinds of diversity. It was just great seeing them there come out. And I mean, it was a blizzard. It was horrible last Friday. It was a blizzard. It was cold, but you know what? They were determined to come and get vaccinated. So again, it was all for our community, and that's why I wanted to volunteer. It was a great thing for our community. We want a healthy Lincoln. We want a healthy Lancaster County, and all the great work. Like you said, I was taking temperatures all day long of people coming in and pointing them in the right direction. Like Ed said, it was a well-run machine, a lot of very, very positive events. So, I just want to say my hat's off to you and all those awesome people who are making this happen. It was really, really great. So again, thanks a lot, Pat. I was really honored to be a part of that team.
Thank you so much, John. We look forward to seeing you again, helping us.
I'd love to come back and volunteer again. You're absolutely right. So thanks a lot. You take care. Everybody stay healthy. And I'm going to head out to the zoo and make sure everybody's taken care of. Take care. Bye-bye.
Bye-bye. So our other vaccination efforts last week included a smaller vaccine clinic in partnership with Bryan Health that provided vaccine to those age 65 and older with serious medical conditions, such as lung disease that increases their risk for severe illness from COVID-19. We worked with the physicians to make sure that we are identifying patients who really needed that vaccine. Our health department also worked with the pharmacy partners to provide on-site vaccination to residents of our independent living communities. And that was about 3,200 individuals, and we'll finish those up this week. Also vaccinated last week were adult and child protective services workers, along with some utility workers who are next on the state's priority list for essential workers. It's really encouraging to see many members of our community receiving the vaccine, and we hope the high acceptance of the vaccine will continue as we receive more doses and expand vaccinations to additional Phase 1B priority groups. Today, we are very excited to announce additional groups in Phase 1B who are eligible to receive vaccine this week. We will be holding 2 large-scale vaccination clinics at Pinnacle Bank Arena. One is a first dose clinic on Thursday for Lancaster County residents age 73 years and older by appointment only. We are now contacting these individuals and getting them registered. When I left the office, we already have over 2,000 of those individuals registered, and we're working up to a larger number. People will need that appointment to receive the vaccine, and we'll make the process smooth and easy, just like we have been. I also want to stress that there will be enough vaccine for everyone who has an appointment, so you don't need to worry about coming earlier. The other clinic is a second dose clinic on Friday for healthcare providers who received their first doses at the arena in late January. Individuals in this group are currently being notified of their appointment times. As part of our ongoing partnership with hospital providers, Bryan Health and Lincoln Surgical Hospital will provide vaccine by appointment through some smaller clinics. These clinics will be geared toward people age 65 and older, as I said, with serious medical conditions. that increases their risk for severe illness from COVID-19. We are currently contacting and scheduling appointments for these patients that meet that criteria. We are also continuing to vaccinate utility workers this week. Next on the state's priority list for essential workers are homeless shelter staff and corrections staff. Another group of essential workers on the priority list is educators, and we're preparing to start vaccinating that group as soon as we have the doses available. This week, we're working with area schools, colleges, and universities to help ensure those who are interested in receiving the vaccine are currently registered via a special link we have sent out. As the mayor mentioned, vaccinating this group will take time because vaccine supplies are limited. And as the mayor also said, we continue to follow the state directive to provide 90% of the vaccine to those aged 65 and older. As we've said before, there are many moving parts and new developments related to vaccine. Our website at covid19.lincoln.ne.gov is a helpful resource where you can find the latest vaccine information along with the list of all the priority groups in each phase and who are currently receiving vaccine. I encourage you to look there when you have questions. We do have more details today on the federal retail pharmacy program for COVID-19 vaccination. The federal program is a collaboration between the federal government, states, and national pharmacy partners and independent pharmacy networks. The program aims to increase COVID-19 vaccine across the country. The program started to roll out in Nebraska last week. Lancaster County has one participating pharmacy, RelyCare, that will provide COVID-19 vaccine to members of the community. We are working with RelyCare on their vaccination efforts through their pharmacy. Their efforts must mirror the state's phase process. Pharmacies participating in this program are receiving their own vaccine allocations in addition to what our department currently receives. Remember, the first step to getting vaccinated is to sign up to receive vaccine using the secure online registration form at covid19.lincoln.ne.gov. While the vaccine is not yet available for the general public, as doses become more available, those who are registered will be contacted to schedule an appointment to get vaccinated. We encourage everyone to receive the safe and effective vaccine as soon as it's available to you. Registration is open to all county residents. Family members and caregivers are encouraged to assist those who need help to register. Those who do not have online access or need assistance may call our COVID-19 hotline at 402-441-8006 to register. The form is available in English and Spanish. Our health department also has interpreters available to assist callers who speak other languages. The state also has a registration site. In Lancaster County, residents only need to register once on either the health department site or the state website. At the health department and the state health department can securely share data as needed. Nearly all of our data indicators we use for our COVID risk dial also have continued to improve during this time. This is reflected in the risk dial moving down one more step from elevated yellow to mid-yellow. Yellow signifies a more controlled level of COVID-19 in Lancaster County, with the risk of the virus spreading now at the moderate level. Our 7-day rolling average of new daily cases has dropped from 135 on January 24th to 49 on February 13th. We have had fewer than 1,000 weekly cases for 5 straight weeks. And for the past 2 weeks, we have had fewer than 500 new weekly cases. The number of weekly cases has not been seen that low since the week ending August 28th. The cold weather has greatly impacted the number of tests being completed, and testing locations have reduced hours. This past week, just over 1,900 tests were completed. This is the fewest tests done since the month of May. The good news about testing is that for those who are getting tested, the turnaround time is quick, often within 24 hours. Our positivity rate is also going down. For the week ending February 13th, the rate was down to 18%. This is down from 29.1% just 3 weeks ago. And we are also continuing to see a lower number of COVID-19 patients hospitalized locally. In the 4 weeks since January 16th, we have seen a decline from 116 patients to 27 this past weekend, which is a 77% decline. The last time we had this few COVID-19 hospitalizations was in August. Today, we have 30 COVID-19 patients hospitalized locally, with 19 from Lancaster County and 11 from other community. Our map also shows how our local metrics are plotted to determine the position of the risk dial. The average testing turnaround time and contact tracing time are nearing green. Contact tracing has moved down into the yellow. Connected cases, community spread, ICU availability, and our new case rate have all moved into yellow. The rest of the metrics have improved some and have moved down into the orange. There are no metrics currently in red. You will find the location of the risk dial now in yellow represented by the square outlined in red. The virus is still active in our community, so this is not the time to let down our guard. Please continue to wear masks, practice social distancing, wash your hands, and use hand sanitizer. Another reason that we all need to continue to be careful is the new variants that have the potential to impact every community. We know many people have questions about those variants, so we have asked Dr. James Lawler to join us today by Zoom. Dr. Lawler is the Executive Director of the International Programs and Innovation at the Global Center for Health Security. He is also an Associate Professor of Medicine at UNMC. Dr. Lawler, thank you for joining us today.
Thank you, Pat. Great to be here. And I just want to point out first, really to commend your leadership and all of the local health directors in the work that they've done in keeping us safe during this pandemic. I know that sometimes you don't get the credit that you deserve, so I want to make sure that that we say that here. And welcome the opportunity to talk a little bit about the variants and news that's been pretty prominent in the media lately. So I think this is certainly a note for caution. As you mentioned, our case rates have come down dramatically since their peak in November. However, we still have case rates that are twice what they were in the summer. And so we've not gotten back down to that level of transmission. And when we're starting to see these new variant viruses circulating in the US at a much higher rate, the most prominent variant that's been detected in the US so far is the variant from England or the UK. And so far, the CDC reports over 1,100 cases of that new variant virus have been detected in the United States. But if you look at some of the laboratory screening data, that would suggest that we've had maybe 100-fold more of those cases than have been officially reported. So we probably have had somewhere around 100,000 cases of that new UK variant, also known as B.1.1.7, in the United States. And the rate of that variant continues to increase, doubling almost every 9 or 10 days. And so by the middle of March, the US should have the majority of its virus as that B.1.1.7 variant. And that's concerning because it puts us in a position similar to where England or the UK was back in November, where they had dramatically declining rates, but this new variant was starting to take off. And by December, they essentially did a U-turn and had a huge epidemic wave that swept across the country in December because of that B.1.1.7 variant. It is considerably more transmissible than the old wild type virus, probably 40% more transmissible or more. And it also is more virulent. It causes more severe disease. And now that's been confirmed even as lately as yesterday with new data released from the UK. And so, as you say, this is not an indication or not a time for us to let down our guard. In fact, it's imperative for us to continue to work at all of the community mitigation measures that we've put in place, including being conscientious about wearing face masks, avoiding large gatherings, avoiding indoor dining and bars where people are inside without masks, and waiting until we can vaccinate a large proportion of the population. The good news is that vaccines continue to roll out across the country, and our pace of vaccinating is increasing both within the state of Nebraska and across the country. So a month ago, we were vaccinating 1 million people a day. Recently, we've been averaging about 1.7 million a day across the country. So this pace is increasing and will continue to increase through the spring and into summer. And at this rate, we should have enough vaccine and have vaccinated a majority of Americans by June or thereabouts. And hopefully we'll get to 75% vaccination rate, and then we'll really see case counts drop. Another piece of good news is that the vaccines that we're currently using, the Pfizer and Moderna vaccines, which are mRNA vaccines, appear to be quite effective against at least this new UK strain. So the experience of Israel, a country that's now vaccinated over 80% of its population with the Pfizer vaccine, recently demonstrated that the vaccine has 94% effectiveness in the population. And we know that greater than 80% of the virus circulating in Israel is now the B117 variant. So the vaccines that we have work. They work against the new variants. They continue to show good safety profiles, and so would strongly encourage everyone who can get vaccinated to get vaccinated. But it will still take us several months until vaccine really has a big impact in blunting transmission. And so while we're doing that, we need to continue to be conscientious about all of the non-pharmaceutical interventions that you and all of our local health directors have been pressing for. Thanks very much.
Thank you, Dr. Lawler. At this time, we will open up for questions from the media.
Director Lopez Riley from the Journal Star.
Hi, Riley.
Hi, Pat. Tell me a little bit about what percentage or portion of that 75 and over group you think have been vaccinated already, and do you have a sense for the percentage of folks that just are not interested in the vaccine at this point, based on the numbers?
Well, I can say from the contacts we have, there are very few that are not interested in getting the vaccine. And we know that we vaccinated just in our own area 10,000 of those individuals 75 and older. In addition, there have been those several thousand that are in independent living situations and others. So Riley, we're working to continue to compile that information, as well as we're working with our long-term care centers and assisted livings. And so we'll have more information for you in the near future.
A couple other questions related to the vaccine clinics. Are people who attend the clinics, are they asked to sort of prove their age and identity when they go there? And sort of what measures do you guys have in place to make sure that kind of you're vaccinating the people that are registered in your system, as opposed to maybe other interested people who don't live here or work in Lancaster County in those priority groups?
Well, each individual has their own unique registration. And for the 75 and older group, Riley, we actually, the first week we sent out invitations. Last week we called all those individuals rather than send out the invitation. So each person has their own unique registration time, and we pre-fill the information that's related to the vaccine for them with their name and birth date. So when people come in, they have to provide us their name, and we provide them with the document they need to take through about some of the health concerns or contraindications for the vaccine. And then they go forward, and we're fortunate in Lincoln that we have physicians who have volunteered, and they do all of the screening of the health indicators for individuals. And so it's really difficult for somebody to come in that we don't know their birth date or they don't have an appointment.
Pat, another question with that population, somebody who has a senior parent is wondering, you know, what are the guidelines or recommendations in terms of them visiting after they've been fully vaccinated, visiting, you know, family, and what precautions should they take, considering this group maybe, you know, went months without seeing family to keep themselves safe?
Well, we said we want everybody to continue to use the same precautions until we get more individuals vaccinated and reach that level. We would really encourage them to wait until other family members are vaccinated, but they still need to use those same precautions of wearing the mask and washing their distance and washing their hands.
This is Brent with Channel 8. You've touched on this in past briefings, and you kind of mentioned the cold weather impact on the really low testing numbers. But I guess what are you able to pull from that as far as, you know, we're seeing these low case numbers, but also the low testing. You know, I guess what are you looking for to really get an accurate gauge of where we're at, because both are so low?
You know, one of the things that we look at, we're doing surveillance with physicians' offices and the health systems, and we do that both for flu and for COVID. And we're seeing very, very low numbers. The other thing that we do is I talk with our hospitals a few times a week, so I know how many have an understanding of what they're seeing in the emergency department and urgent care. And those numbers are down as well. So we don't have a lot of sick people coming in. And I think, Brent, you may have seen our flu numbers are at a very, very low level.
Unrelated question. I don't know if this is the right word, but do you agree with the state's directive that 90% of the vaccine doses should be going to the 65 plus group? Or do you think there are any specific groups that should be getting it now that aren't?
You know, we provide feedback at times when we have an opportunity to do that. And the one thing I think is really important is that we follow an organized approach. And right now that's the approach that's been decided with input from CDC and as directed by the governor, and that's the process we intend to follow.
And then a question for you and Dr. Lawler, if he would chime in as well. But you know, we're seeing the numbers trending in the right direction. I don't think anyone would say we're out of the woods, but is it safe to say that we've at least turned a corner when it comes to fighting the virus?
If Dr. Lawler's on, I'd like him to answer that.
Well, I think it's hopefully clear by now that this pandemic will continue to be a course of twists and turns. So yes, I think we've turned one corner, but it doesn't mean that more corners are not ahead of us. And so I think we need to be really cautious. This is, to be honest, I've told folks, this is probably the most unpredictable point that we've faced yet in the pandemic. I think that for better or worse, given our response, everything has played out relatively predictably until now. But there are so many competing factors, including these new variants, increasing vaccination rates, and everything else, that things could break many different ways now. And so it's definitely not the time to relax, but certainly very encouraged about the case numbers we've seen recently and the fact that we're seeing many fewer folks in the hospital. And some of that's also due, I think, to some of the new therapeutics that have been introduced that have shown that they're able to dramatically reduce hospitalization for high-risk folks if given early enough in the course of illness.
Thank you.
Pat, this is Ellis with 1011 here in Lincoln. I was just circling back to sort of the teacher link that's going out. Could you talk us through maybe what some of those questions are? And as those roll in, will you be prioritizing people within that category, or will those vaccines be sort of first come, first serve on who fills out maybe their sign up first?
No, there's no first come, first serve with any registrations we're doing. They're specific. We worked with all the school administrators, and there's some specific questions on there about the various roles that individuals have in the school system, both K through 12 and in higher education. And of course, we're going to be looking at those 65 and older, and those with some other serious kind of health conditions, and then we'll work from there. You know, at our current dosage rate, it's going to take a while, and we have close to 21,000 individuals that will need to vaccinate. So we'll work through the process systematically. And their registration is very similar to the other registration, just date of birth, physician name, any health conditions that they have, an email, so that they'll be provided an individual link for an appointment time when the vaccine's available.
Director Lopez, with the essential worker groups that you are prioritized and working through in 1B, what are the challenges in sort of selecting which group gets it next? I know you've mentioned supply is the biggest factor, but are there sort of unique challenges that Lancaster County has compared to other health directors when working through these priority groups?
Well, I don't know that it's a challenge necessarily, but it's a good thing that we have so many people that want to get the vaccine in those groups. But all their employers have furnished us numbers and names that we know. So you're right, Riley, the biggest challenge is getting enough doses. And then these folks are very nimble and come when we tell them that we have those available doses, that 10%. And it's just working through that that matters. But I have to say that just like our folks that were 75 and older and 80 and older, when we call and it's their turn, they're very, very happy to be able to come in and get their vaccine. It's just that I wish we had more vaccine.
And you might have touched on this earlier, but I just wanted to follow up. We'd received an email from an elderly couple with I think an 80-year-old and a 76-year-old, and they had signed up on the state's website, vaccinate.ne.gov or whatever the website is, but they said they had not yet been contacted by the health department. Are you encountering problems, and or if you're somebody in that group that should be eligible and hasn't received contact from the health department, what should they do?
They can call that 402-441-8006. And actually, sometimes, Riley, they reach out to me. But we are transferring a file back and forth back from the state to us so we can get individuals in. I'm not saying that there can be an occasion when something hasn't happened. I worked with a couple today this morning and was really grateful they reached out because we can't fix something if we don't know that it's happened. So it'd be great if you could let us know so we can reach out to them. Okay.
Okay, are there any further questions from the media? All right, then, thank you once again to Ed Love and to John Chapo, and of course to Dr. James Lawler for being with us today. And thank you to everyone in our community for joining us this afternoon and for being team players in this matchup against an invisible opponent. The actions that you are taking to stay safe and stop the spread by wearing masks, washing your hands, and watching your distance from others while avoiding crowded places and confined spaces, they are vital to the success of our offense. Keep it up. You are vital to our community's progress on the path forward out of this pandemic. Stay warm and see you next week. Thank you.